And dental care. Have you been putting it off? Is it safe to go back to the dentist? Is it worse not to go? What protections are in there? And we've got information for you that you can sink your teeth in. Coming up next on Fox 11 News In Depth. Are your teeth starting to look a little dingy? Is there a little twinge in there somewhere? Well, we'll tell you if it's safe to go back to the dentist after the break. Be right back. Welcome back to Fox 11 News In Depth. I'm Hal Eisner, and most of us have changed a lot of our usual habits during this pandemic, right? An attempt to keep ourselves and others safe from the virus. Well, as the months wear on, there are some practical habits that we may want to resume safely. And one of those is dental care. You know, if you've been avoiding the dentist during this pandemic, yeah, maybe that's not a good idea. We're going to find out now from Dr. Cami Haas. He's the CEO and co-founder of the Super Dentist. And with a name like that, I expect to see you with a cape. But anyway, I'm told that they have been very stringent at his dentist office as for protecting people and methods that they use for the patients and the staff. And why don't you tell us a little bit about that, Doctor?
Absolutely. So ever since mid-May, dental offices reopened, there are dental offices across the country. We've actually had 0 cases of COVID transmission reported anywhere between any patients or dental offices. That shows you just a remarkable safety record that dental offices have had. And that just goes back to the mid-'80s when I was in dental school that we had to deal with the HIV crisis. So I think since then, we've had just some really amazing protocols in place to keep everybody safe, our patients, our staff, and our doctors. And during COVID, when the offices were closed between March and April, May, we really put some efforts and brought in a lot of technologies, modified a lot of our systems and our protocols and procedures to make sure that we keep patients safe during this pandemic as well.
One of the things I know is that we don't have super teeth. And if we don't take care of these teeth, they're not super anymore. And so when people put off their problems, what happens? And some people may be saying, well, I don't want to go back out there until there's a vaccine. Is that a good idea?
It's not a good idea, but that's very common. In fact, American Dental Association did a survey across the country a couple of times, and they found out about 15% of people, they want to wait it out and wait for a medical breakthrough like a vaccine. Another 15% are on the fence, and they need people like me to educate the public about how it's safe and it's necessary to go to the dentist. So let's start with safety. As I said, the dental offices are very safe. In fact, it's probably one of the safest indoor places. There's been no COVID transmission between cases anywhere across the country. So that's the first thing. As far as the necessity of going to the dentist, first of all, for your teeth, if you don't go to the dentist, your dental problems are not just going to pause because there's a pandemic and wait it out. Cavities are going to get bigger. They're going to need root canal. They're going to need extractions. Something simple is going to turn into a big deal, more cost. Orthodontic problems are only going to get worse. Gum diseases are only going to progress. And then on the medical side, there's been some recent amazing studies that show that actually poor oral health can significantly increase your risk of COVID-19 complications. So not only going to the dentist, it's safe and it's necessary for your dental health, but it's actually good for your overall health, especially during the pandemic, and actually could save you, from potentially life-threatening complications if you get COVID. So for those, all those reasons, I really encourage people not to postpone their dental visits. Yeah.
Well, I mean, there are challenges to all of this. I mean, nothing is ever perfect. So what are some of these challenges that you run into in dental work? I know when I go to see a dentist, they're wearing the masks and, they're all PPP'd up. But I mean, what are you doing and how much is that costing you? And do you have to pass that on to the patient somehow?
Great questions. Yes, it's costing us an arm and a leg, a lot of money. But obviously, this is worth every penny because we keep our patients safe, we keep our staff safe, we keep our own families and our doctors safe. So it was a kind of a given that we were going to invest in it. So we really modified everything to answer your question. From the moment that you call the dental offices, you're going to realize that the screening process is different. Obviously, they're going to ask you the typical questions, all the COVID-related questions about fever and cough and everything. Then before you're allowed to enter the dental offices, you screen for fever and you go through the questionnaires again. Then before you're allowed to sit in the dental chair, you have to use a mouth rinse because we've been using it for several months, but some of the new research shows that it can potentially reduce the transmission rate significantly. So that's one more layer of safety that we have for our patients. Then, of course, we don't have a reception room like the check-in process starts really from your car. So you can check in, you can do all your paperwork on your phone or tablet. You can, even be entertained and educated in the car or outside of the office. There's no more like magazines or paper passing around the office. Then our dental procedures have been modified, so we either reduce or eliminate the aerosols that are produced. We've revamped our HVAC systems so to kind of clean the air between patients. We have UV systems. I mean, literally, there's nothing that we haven't changed, and that's probably why we're so safe and we have such an amazing safety track record so far.
It's interesting to hear a guy who talks. It's interesting to hear a guy who works with teeth say it cost an arm and a leg. And so, we talk about costs. This stuff can get pretty pricey. Look, these smaller dental offices, can they survive? We only have a minute left.
That's a good question. Actually, there was an article a couple of weeks ago that many offices across the country are not surviving because their production is down, patients are not going. They have these additional costs. There are some costs that doctors are transferring to patients, minimally like $5 or $10. Most insurances now pay for those additional PPE costs. So some dentists do it differently, but there's a trend now for some of these dental offices that are not going to make it to sell their practices to the bigger DSO organizations that they can manage the crisis a little bit better.
Wow, that's interesting to hear. I hadn't heard that before. Dr. Haas, thanks so much. Good to see you. You have a nice smile, by the way. Good thing for a dentist, right?
Oh, you're so sweet. Thank you very much.
Very good.
Be safe. Thank you.